Still 2 o'clock, so sharp 2 o'clock.
Neresh? Yeah, I'm testing it now. Can you please? Can you tell Mohammed to go live? Okay, I'm telling the guys to go live so I can test.
Okay.
Hello? Yeah? Yeah. Ngingiphi? Khanya sebenza ngibhizi. Ngingibhizi. The sanitizer. Yeah, what is sanitizer?
Ufike negciwane.
Cha sifike sanitizer ekuseni sanitizer means sanitizer right. Siyathi contaminator la before siqala. Can you pick up anything more? Anything, Niresh?
At the moment, you're not streaming yet.
Wanakhuluma Mohammed? Huh? Yeah, he has gone live now.
Okay, yes, okay, I can see you now.
Can you see how good looking I am?
Yes.
And your sound.
Thank you all last time. Change it up a bit.
No. Don't be confused by the colors. Eh? It's a new suit.
Yeah, cool.
Yeah. So the sound is fine. It's perfect.
Yeah, everything is fine. 100%.
Oh, wonderful. Okay. So we're good to go. We're gonna be going straight at 3 minutes 5 past. We're starting. Okay. No, hang sabut.
Mzobe generate. Okay. Alright. I'll just wait for your signal, Genji.
Oh, you.
Thank you very much, colleagues. Let's welcome the President and to this media for this week. About to start, the trust with colleagues all set. As always known, I indicated that was run by all people of the province, Premier Sihle Zikalala, as well as the Honorable MC for Health, who are going to be giving us an update with regards to the KwaZulu-Natal Premier Sihle this week. Without any further delay, I will hand over to the Honorable Premier to take us through the
Thank you. Thanks, Mr. Mabaso. Honorable MEC for Health in KwaZulu-Natal, Ms. Nomagugu Simelane Zulu, the officials who are present, members of the media, distinguished guests, ladies and gentlemen, we once again extend a warm welcome to members of the media who continue to be our valued partners in telling the COVID-19 story. This is particularly so when it comes to the dissemination of information, important messages and regarding what this disease is and how to prevent it, and our government is ensuring support and access to screening, testing, isolation and treatment of patients. We will want to start by congratulating all individuals, non-governmental organizations, and the business community at large who joined hands with us yesterday by displaying a spirit of voluntarism as part of the Nelson Mandela International Day. In a moving display of humanitarianism, some of these compatriots unveiled brand new houses. Others delivered food parcels, and others delivered lectures and messages of hope to the poor. Many of activities and discussions took place under a very important theme, and I quote, tackling inequality, a new social contract for a new era, close quote. These warm and kind gestures of goodwill carry an even higher level of significance at a time like this when COVID-19 has caused so much economic devastation, including the loss of people's livelihood through the closure of firms and job losses. Nelson Mandela was one of the greatest leaders of our time, dedicated his entire life to the service of humanity. As a human rights lawyer, a prisoner of conscience, international peacemaker, and the first democratically elected president of a free South Africa. Occasions such as Mandela International Day therefore remind us of the importance of looking within and asking ourselves how we can be of service and assistance to those who are less fortunate. But this is a question that we should only ask ourselves not only this one day, but every given opportunity throughout the year, so that we can make every day a Mandela Day. We wish to pass our condolences to the Mandela family on the passing on of their daughter, Zinzi Mandela. In the same breath, we once again send our deepest condolences to the Mandela family on the loss of their daughter, Zinzi, a freedom fighter in her own right, and our ambassador to Denmark, who passed away on Monday and was laid to rest on Friday. Sithi hamba kahle dadewethu, and to the family of Mandela, sithi duduzekani nilale ngenxeba alwehlanga olungehliyo. With regard to the situation right now concerning COVID-19, this week we welcomed announcements by the President of our Republic, His Excellency President Cyril Ramaphosa, on the enhanced Level 3 adjustment risk strategy, which he made on behalf of the Cabinet and the National Coronavirus Command Council. We reiterate our support for the decision by the NCC to ban with immediate effect the sale of alcohol and the introduction of the 9 to 4 a.m. curfew. Since this announcement, our primary analysis indicate that the decision was correct. We are already starting to see some signs of the easing of pressure on our trauma, accidents, and emergency units in hospitals, as well as the mortuary admission of people who have died due to violent causes. However, we are also conducting a more detailed analysis in this regard, and we shall share further details with public in due course. We once again urge the people of KwaZulu-Natal to cooperate and support this decision, as it is in line with the health interest of our citizens. We know it's not easy, but it is the greater scheme of things. It is the right thing to do. Let us cooperate and support the decision by the government. As KwaZulu-Natal Provincial Government, we will ensure that there is tightening of the implementation of the announcement by the President. This will our contribution to a reduction of the rate of infection, in order to ensure that beds in our provincial healthcare facilities are utilized to assist the sick, and that alcohol-induced accidents are eliminated. We wish to acknowledge and affirm the role and position of organized labor formation as an important ally in our fight against this common enemy that is called coronavirus. As government, we will continue to ensure that healthcare workers and every other category of employees who are at a particular risk of contracting COVID-19 has all the protection that they need to prevent getting infected. Organized labor is a vanguard of the working class. They are our comrades, our brothers and sisters. They are a vital vessel that link us as government with the foot soldiers who give meaning to our policies and programs as part of the National Democratic Revolution. Therefore, where challenges inevitable arise, we will always welcome robust engagement. With regard to statistics of COVID-19 in KwaZulu-Natal, as predicted, our curve is rising as we continue to see a sustained rate of transmission in the province, just as in the rest of the country. As of yesterday, KwaZulu-Natal has had 37,287 positive cases, of which 26,262 were still active cases. Sadly, we had 121 new deaths this week, bringing our toll to 401. We also had 2,113 new cases and 10,624 recoveries. A week ago, we had 23,751 positive cases, of which 17,450 were still active, 280 deaths, and 6,021 recoveries. This therefore means that in just 1 week, we have had 13,536 new COVID-19 cases, 121 new deaths, and 3,103 additional recoveries. The province contributed 16% of the new cases reported nationally and continued to be the 4th highest countrywide. The surge continues with eThekwini and Mkungundlovu district recording more than half of the daily cases. The mushrooming of private laboratories continues to be a challenge in the province. Some of these are testing people do not complete demographic details of patients, including residential address, telephone numbers, and facility names. As a result, the province is experiencing the increase in a number of unallocated cases. Distribution of cases by reporting date and district. The median number of cases reported in the province since the beginning of July was 1,667. Of the 2,113 new cases that had been recorded by the 17th July, eThekwini district had recorded 39%, followed by Mkungundlovu at 18%. Mkungundlovu district remains the 2nd highest with COVID-19 provincially and has been receiving an average of 270 cases daily since the beginning of June 2020. eThekwini district has been receiving an average of 781 cases daily since the beginning of July, while Amajuba district has been receiving an average of 60 cases on daily basis within the same period. We give the breakdown of cases and the deaths by district, and we are going to circulate that. Safe to say, eThekwini, the total number of cases is 18,551, and the lowest is Umzinyathi with 703 cases, and the deaths in eThekwini is 237 deaths, and all districts have now suffered deaths, and this is becoming a problem. If I may take you through some of these, maybe in just briefly, through these cases, Ilembe is having 1,729 cases, Mkungundlovu 5,958, Uthukela 1,709, King Echwayo 2,328, Uku 1,310, Amajuba 1,583, Umkhanyakude 318, Herikwala 927, Zululand 1,020, and Umzinyathi 703. In terms of incident risk by district per 100,000 population, the overall incident risk for the province was 212 cases per 100,000 population. Mkungundlovu district has the highest infection rate of about 330 cases per 100,000, and it's followed by eThekwini. Umkhanyakude is the only district with incident risk of less than 50 cases per 100,000 population provincially. Amajuba district has incident rate of 200 cases per 100,000 population. Incident risk table, we are presenting it here. and we will ensure that it is circulated to all of you colleagues. In terms of laboratory status in the province, of 2,113 new cases that had been reported by the 17th of July, private laboratory confirmed 71 of cases. Laboratory testing status by the types, we will also provide the list here, but we can say that the public is at 70% and private hospital is at 30%. In terms of admission, by the 17th July, the province had 1,164 patients admitted in private hospitals, while 410 in public hospitals, giving us a total of 1,574. Of those admitted, 260, or just 17% of patients, required intensive care services, with 56, or in terms of numbers, 145 of those were being ventilated. No fewer than 171 of the patients were admitted in high care unit in private hospitals, while one is in a public hospital. Persons under investigation, KwaZulu-Natal has had an increase in the number of persons under investigations, which is PUI, admitted in public facilities. 12 of the admitted PUIs occupied ICU beds, with the vast majority of them being on ventilation. With regard to the infected healthcare workers, amongst the 37,287 cases in KwaZulu-Natal, 1,557, which is 5%, is healthcare workers who are infected with COVID-19. Approximately 60% of the infection of healthcare workers are nurses. Of the total infected, less than a percent have succumbed to the disease since the beginning of the pandemic. Nevertheless, those deaths are 12, and that's too many. May their soul rest in peace, and we send our deepest condolences to their families. With regard to comorbidities, the most common recorded comorbidities are among the deceased are hypertension and diabetes. The proportion of HIV and AIDS infected disease is around 6%. And with regard to recoveries, the overall proportion of recoveries for the province is 28%. The increase in the number of new cases contribute to a decrease in the proportion of recoveries. Contact tracing, the province of KwaZulu-Natal has managed to identify 32,618 contacts, while being able to monitor 90% of them. The positivity rate amongst the contact was 3.2%. Mzinyati have the highest proportion of contact who tested positive. With regard to community and facility screening and testing, a total of 8,744,722 cases were screened in the community and facilities from the 8th of April to the 16th of July. Of the total number of people screened, less than 2% were tested for COVID-19. The positivity rate for community and facility screening is at 3.4%. In this regard, we want to thank all those who made themselves available to be screened and to be tested. We also pay tribute to our teams on the ground who are carrying out this very important work. As we conclude, we wish to thank all of you for your sterling work in continuing to ensure that we engage with the communities and have constant engagement on all of the issues that we are addressing relating to this pandemic. I thank you.
Thank you very much, Honourable Premier. Before we take the questions, there is another important part that the Premier is going to be taking us through in relation to the statistics as they were received this morning.
Thanks again. As we indicated that the statistics in the province, maybe to bring an updated one, as of yesterday, KwaZulu-Natal has had 40,045 positive cases, of which 28,574 were still active. And sadly, the deaths, instead of 121 new deaths, the update is that there has been 136 new deaths in KwaZulu-Natal, and that has brought the total of the deceased to 416. We also had 2,758 new cases with 11,055 recoveries. So that tells you that the increase of cases, this means that in just 1 week, we have had 19,706 new COVID-19 cases and 136 new deaths with 5,034 additional recoveries for this period alone. Thank you.
Thank you very much, Honourable Premier. We are going to move into questions. I see your hand passing, and I'm also going to be taking questions that have been raised by colleagues in the other platforms. Any other hand, Sheila? Okay, we start, Pat.
Okay, the questions are more directed to MEC. Two questions essentially. The first one is to get a reaction in regards to Inkosi eThekwini. We've just been told that there are more than 300 cases now. And because there's so many cases, it's like, how is the department coping? Because, you know, there's potentially a lot of staff missing. And also to find out which departments have been most affected within the hospital. The second one is also, Discovery has just put out a message detailing the areas within eThekwini that are most affected, the so-called hotspots. I believe the department had a stance in regards to that they won't give the information that is that detailed. So I just wanted to get your view, since a private company went and did something that the department is against.
Thank you, Sheila.
Owami umbuzo wokuqala ngibhekise ku-MEC khona ukuthi njengoba kunale lento infecteka kwabantu abasebenzayo ama-health workers kuma-institutions, yini mhlambe umnyango oyenzayo ukuthi kuzame ukuthi kuprotecteke nabantu abasebenzayo ukuthi bangatholi ukutheleleka ngalo gciwane. And omunye umbuzo wami ngobhekise kuNdunankulu ukuthi kunombono la abantu ukuthi uhulumeni uye wavulela ukuthi abantu bangakwazi ukuthi baye emasontweni enkonzweni. Kodwa manje kunale issue ukuthi kuthiwa imicimbi ayivunyelwe ukuthi yenziwe. Kanti manje kuneminye imicimbi esuke ngempela kungeyona yokujabula njengaleyo ukuthi nje mhlawumbe ngonyaka odlule bekushonile ubaba ekhaya, manje sekufanele kukhulunywe inzima noma sekufanele kubunyiswe umuntu. Manje imicimbi enjalo mhlawumbe singambona yini uhulumeni ebacabangela abantu kuleyo ndawo, ngoba yonke into manje imile and nale COVID akwaziwa ukuthi into ezophila nini ngoba in the beginning kwangathi into nje ezoshesha iphele mhlawumbe kodwa manje kuyaqhubeka, it seems like sizophila nayo forever. Ilokho umbuzo wami, ngiyabonga kakhulu.
Thank you. May I just add a few more questions to the panel? The other one is asking about what's the Premier's view on the calls for schools to close in light of the sharp increase in COVID-19 infections. The witness, Nianta Singh, is asking what enforcement measures, if any, will be implemented in areas identified as hotspots in the next few weeks. Is there a contingency plan to deal? Is there a contingency plan to deal with the rising infections, especially in view of the fact that nurses are also getting affected, and this is actually impacting now on the treatment of patients because there are few nurses and more patients. Kylie from the Mercury is asking with regards to the mushrooming of private laboratories, those who are not filing out proper information on those they are testing. What's the position of the department as far as that is concerned? We'll take the second part. We still have quite a number of them from colleagues that have been asked as well. May I request the panel to answer this first one for now?
Well, I think I will answer only one question and then allow MEC to take on others. Or no, two. The first thing is about ceremonies. It is quite a very challenging experience. We're going through a challenging moment where we have to adjust. And nothing more than, no event more than 50 people or event that will be attended by more than 50 people will be accepted. And that principle stands, and it is very important. In this regard, some people have been able to do things on their own as families, which is appreciated. And others have taken a decision that they will shift big ceremonies to the later period. And we want to thank them for that. We equally would want to thank the traditional leadership under the leadership of the Provincial House of Traditional Leaders for working with government in sending information to communities, especially to ensure that people adhere to the 50 people who attend events, especially funerals. And in most areas, people have been trying their best to adhere to this rule, but there are those who just do events that are not necessary, including social events. All of that will not be accepted. And that's why we are saying we will tighten the regulations and our monitoring approach. With regard to the closure of schools, we will not want to interfere with the process because the national government is dealing with this. But with regard to us as KwaZulu-Natal, having had the return of matric and later, or matric, which is grade 12 and grade 7, and later there were also 2 grades added. We are of a view that it will not help us to keep on increasing while the rate of infection is still increasing. So we are engaging on that. And if it comes to a push, maybe it will help us to keep those key grades only, like keeping grade 12 in school, and maybe 1 that will be key. Others are arguing for grade 12 and 11. Others are saying no, grade 12 only. We are engaging, and it is only the national government, the cabinet, and the minister who will speak on that. We are taking our own contributions and feed to them, and we will await their leadership in this regard. It is not that we are ignoring the challenge. We see the challenge. We are communicating with the national leadership to ensure that we take a collective approach on the matter. I know that it's not easy to answer the issue of ceremonies. It's safe to say no ceremony is opened up for now, unless the small thing you do in your family for yourself, then not being more than 50. That is then fine with that. Thank you.
Good afternoon, ladies and gentlemen. Afternoon, Premier and the colleagues. We have a few questions. The first one speaks to Inkosi Albert Luthuli facility and the rate of infection that has gone up there. The number that is indicated, it is indeed about 300 so health workers, but we must remember that when we say health workers as the Department of Health, we are not just talking about nurses. We are talking about nurses, doctors, admin staff, general orderlies, and everyone else who is in the facility. So in essence, that 300 doesn't speak to the nurses only. The number of infected nurses is just above 100 in the facility. Of course, that is a high number on its own. So it's not a justification. I'm just saying that there is a breakdown to that. What we decided to do, and I think I'll probably be linking it with another question, is that on Friday we had a meeting with the CEO and the management of Chief Albert Luthuli, including the organized labor there, to deal with this issue in particular. And among other things that we agreed on is the fact that we will then have to properly investigate the usage and availability of PPE in the facility, because from our documents there is enough PPE. So we will have an opportunity to go around and look at their availability. But we also are worried about the fact that there might be an issue on how the PPE is utilized in the facility itself. But the one thing that we agreed upon between ourselves, management of the facility and organized labor, is that they need to have a committee. And they've started establishing the committee. They need to have a committee that's going to be responsible for the health and safety of the workers, and the responsibility of that committee, and it includes all the stakeholders within the facility, is to ensure that they walk about on a daily basis, on an hourly basis, make sure that everyone has the proper PPE on and everyone is utilizing the PPE correctly. So that is what it's one of the systems we've started to put in place in relation to Inkosi Albert. But I must also indicate that the Health and Safety Committee is not just supposed to be at Inkosi Albert Luthuli. It's a committee that's supposed to be in all the facilities. And we have picked up that some of our facilities might have these committees, but some of these committees are not functional and some are just not there. So as of last week, we started ensuring that these committees are in place. We also visited Edendale Hospital last week and we did the same thing. We also picked up that they didn't have a functional committee and we have put one in place as of last week. But in Edendale, we walked around and looked at the PPE. The PPE was there both at the stores and within the wards. Now, it's also then important to ensure that this committee is functional, because on the spot it will be able to pick up the problems and be able to implement whatever remedial measure that needs to be implemented. I must just then also indicate that in relation to the work that is supposed to be undertaken by those health workers that are now currently in isolation or in quarantine in Albert Luthuli in particular, we've decided in the province that we are going to have a couple of teams that are going to be of health workers that will go where there is a shortage.
and they will be moving around as and when there's a need. So we are going to start with Albert, because Albert seems to be one facility that is mostly affected. But I think I need to also just speak to the issue of the PPE again in relation to Albert. I know every week, Premier, when we come here, when we ask about PPE, it's not about general PPE, but it's PPE of Nkosi Albert in particular. Now, I think we need to deal with this issue once and for all. There's no shortage of PPE in Nkosi Albert. And I'm saying this categorically. There is no shortage. They have sufficient PPE. The challenges that we have in that particular facility is that there are some health workers that believe they should be given a particular kind of PPE that is not in the guidelines. Now, the guidelines that we are utilizing as the Department of Health are guidelines that are coming from the National Institute of Communicable Diseases. Now, Nkosi Albert is a very big hospital. It's a specialized hospital, but health workers there cannot be treated differently from health workers in any other facilities. So we are going, and we have committed that we are going to ensure that they get the correct PPE, and the PPE that is given at a facility is the correct PPE at the level that they are in. So it's not the whole hospital that is going to get the equal kind of PPE. It depends on the level of exposure that is in that facility. I hope this puts the issue of PPE because Albert Lutuli at rest once and for all, because in essence, we know that it's one issue. In fact, about a week ago, I requested the head of department to go and meet with the health workers in Nkosi Albert Lutuli, primarily because they were insisting, well, not some of them, I must be fair, some of them were insisting that there is this particular PPE that they saw some doctors wearing elsewhere, and they are insisting that they need to get that PPE. It's something that is called coveralls, that is not particularly on the list of the NICD protocols. So HOD had an engagement with those particular health workers that were complaining, and they agreed that, well, it's a nice to have, what they were asking for, but it's not what is actually an instruction from NICD. So we are then dealing with the issue of PPE in Albert Lutuli, and we are trying to clear up our... Look, we've also picked up that there is the issue of a breakdown in communication between the management and the organized labor. We are correcting that. And I mean, there should never be a time when organized labor is unable to speak and understand each other with management. So they have started working on that in particular, and by the time we got to them on Friday, they were already telling us that they've corrected the issue of the Health and Safety Committee. The organized labor is beginning now to see it in the JOC. JOC is the structure that deals with the day-to-day running of the facility, and the communication, they are beginning to correct that. So what we also agreed on is that the issue of the infections of health workers is something that we need to sit down and correct together. We cannot afford to be pointing fingers at one another, because if we continue to do that, then it means the health workers are going to continue to be infected. So we need to sit down, identify the blind spots, and be able to correct them. Some of the blind spots are blind spots that come from a social level, and when they come into the facility, we then need to correct them. Remember, as health workers ourselves, we live in the community, and right now we are faced with what is called a community spread. So we also need to be able to correct that. So we are working on the challenges that they are faced at Albert Lutuli. In relation to what is government doing about infected areas, I think I've spoken to that a little bit, and I've just added what we have done in Albert. What we are doing in Nkosi Albert is something that we are going to do, and we have started doing in all the facilities. So like I said, we've got that particular, or that group of a cohort of health workers that are going to be moving around as and when there's a need, and where there is a challenge, and our health workers are beginning to be thin on the ground, so that we give them an opportunity to recuperate, go into quarantine, and then be able to come back into the facilities. But we've also strengthened and the protocols of the guidelines. You know, the guidelines, there are guidelines that are out there that are saying to the health workers, this is what you need to do on a daily basis, this is what you wear, this is how you wear it, this is how often you wear it, and all of that. So we are strengthening that communication in our facilities, including putting up big posters reminding our health workers on what needs to be done, and so forth. We are also emphasizing and strengthening we are retraining. We are not just training, we are retraining, because this is training we had conducted before, but we are going to redo it again in all the facilities, just to ensure that we all remember what we need to do on a daily basis. But we also agree that we, as a department, we also need to be very strict on what kind of PPE is in a facility. Is it actually there? I'm saying this because I've been saying in the past few weeks that on a daily basis, myself and the minister, we receive a report from facilities that indicates what PPE is where and how much and what needs to be brought in. That is what we get on a daily basis. And when you look at the spreadsheet, you are able to pick up where the shortages are, and head office is able to come in and intervene where it's necessary for it to do so. But with the head of department and the management, we've also decided that that's not enough. We also need to go into the facilities ourselves and personally go through the stores and see whether that PPE is actually there. And besides the PPE being in the facility, is it being distributed accordingly to the wards? And we are doing that. And what we also have agreed upon and is being now done in the facilities is that when a responsible sister or a responsible health manager issues PPE, people must be able to sign for it, so that we are then able to see that actually on a daily basis you have issued the correct PPE to the people that are supposed to be receiving it, and they have signed for it. So we've started doing that, and we think that's going to assist us in ensuring that everyone gets the PPE that they are supposed to be getting. The reason why we think it's necessary for us to do this is because we also don't want to just say it's the other side that's not doing their part. We also need to look at ourselves and ensure that from our side we are actually providing the PPE as we say we are doing, and we are strengthening our systems to ensure that PPE goes out there as it should. In relation to the private labs, this is a serious worry, I must really indicate. And the unfortunate thing is that some of these labs, they would not necessarily come to the department and say to us, we are here, we are functional. We only see their functionality when we start receiving results that come from them. And some of them just open, they just pick up a spot, put a gazebo and start functioning from a gazebo. Or some of them would just get into a driveway, put a vehicle, and people come in and they test them. Now that becomes a serious problem, because sometimes the service that they are offering to the community is a service that is saying it's quick, we will test you, you'll get your results very quickly, but also when we are testing you, you don't have to get out of your car, you don't have to spend a lot of time with us. Now, it's very unfortunate, because that process, that's the process where the information should be taken. When you take a specimen, there are specific issues and specific data that they are supposed to be picking up from the different patients, and they don't do that because they are trying to ensure that what they have promised their clients of a quick service is actually adhered to. So we've decided with the head of department that this week we are going to round as many of them as possible. Unfortunately, we only get a list as and when we get reports or results from the National Health Laboratory Services. So the list that we have of those mushrooming labs will come from NICD, and that is how we are going to be contacting them. So we are going to contact them this week, put them into one meeting, virtual meeting, because we've decided that virtual meetings are important. We'll get them into one meeting and have an engagement. We had a similar challenge around March when the virus was beginning to pick up, and it was a new thing. Medical doctors were not sure of how to handle the matters, in particular in the area of Mgungundlovu. And we did a similar thing. We spoke to all the health workers, all the doctors at that particular time that were testing and taking information, and we took them through how they need to complete that particular form that needed to be filled. So that worked, and within a week or so, that problem was cleared up. So now we are beginning to see the problem re-emerging, and we will meet with the people who are responsible and try and sort it out in that particular fashion. Thank you very much.
Thank you. Just potentially give the stage for now. There's a question around the student that took the department. They want a comment from the MSc with regards to that.
What is the question?
The real question is from the SABC, but it's also been asked by the Daily News. I need comment regarding the student who took the department by posing as a medical intern for years. What are the requirements to be accepted as an intern in any hospital? It's one of the stories in the newspapers.
Okay. In fact, before I get to that, there's one question that I left out that was speaking to eDiscovery. eDiscovery issuing detailed, what they consider to be hotspots. I think sometimes the private sector, they take some of the responsibility that belongs to government to themselves, because, when we say these areas are hotspots, we often have guidelines that are indicating what are hotspots. Having said that, as a Department of Health in KwaZulu-Natal, we decided about 3 weeks ago that it is necessary for us to indicate to our people what the hotspots are. And on our own, outside of any private organization, we have actually been issuing these statistics. So, some of you would know that on Thursday we had an engagement with the media on social, some of the social platforms, and in that particular engagement, that's exactly what I did. I went through the statistics of eThekwini and indicated which areas have a high rate of infections. I went through the same thing with Umgungundlovu as a district, and the commitment that we made was that every week we are going to be going through the different districts, because we didn't have when you look at the 11 districts, when you go through every district and name them one by one, it takes you more than an hour to actually do that. So we did that with 2 districts last week. We are going to do the same thing this Thursday and indicate. But one of the things that I indicated when we had that engagement on Thursday was, when you look at Umgungundlovu and Umsunduzi in particular as a hotspot, just on Thursday, in Ward 29, which is, I think, the Northdale area, they had 341 infections only in just that particular area. And we've had an engagement with the local leadership and the command, the district command council, on agreeing. Well, we had an engagement and said, what are other social issues that needs to be engaged so that we are able to deal with this? When you look at Ward 29, Umsunduzi, and understanding the nature of Northdale, you will know that it is a very busy kind of a center. And when you walk around, you often find that people just walk around in groups. They're not wearing masks. They just engage as if it's business as usual. But they're not the only ones. You go to some of the townships in eThekwini. In fact, you go to all the townships in eThekwini. When you walk around, the first thing that you see is that you find people walking around in groups, sometimes just standing in corners, having a discussion, no mask on, So adherence is a problem. This is a social issue that we are faced with. That is why then we decided that we need to start issuing these statistics so that people start realizing that actually the virus is in their communities. What we had found in the past few weeks was that people started asking you that, no, who do you know? You say we must take care of ourselves. You say we must make sure that the virus doesn't move. But corona. At some point we were asked, there was something that was on the social media, a gentleman that was asking all of us that when we keep on saying they must stay at home, who do we know that has been infected? Who do we know that has died? But today, all of us will tell you, we know of a person, a family friend, a family member, sometimes ourselves, who have been infected with the virus. But we also know of someone who has passed on. Someone within our communities, some within the groups that we live with, some within our own families. So the challenge and the reason why we've also decided to start issuing this is because we think people think this virus is very far away from them. It's not them. It doesn't affect them. So we have started issuing the statistics, and we started issuing that about three or so weeks back. Let me then respond to the issue of this Ndlovu lady. Firstly, I must indicate that we might not be able to give details because this matter is in court. And you know, when matters are in court and the matter is sub judice, you must then tread very carefully. However, there is certainly a case that has been opened, a criminal case that has been opened up against this Ndlovu lady. And it's not that she has duped the department for years, because that's not really possible. However, the process of getting in fact, she came in for a couple of months, we are told, to try, and during the holidays, student doctors are given an opportunity to work in facilities, and management must be able to follow up and ensure that they've got the right information from the medical schools that they come from. So this lady moved around some of our facilities, it is alleged. I think I must emphasize that. It is alleged that she moved around some of our facilities during that particular time and posing as if she's a medical doctor. So the matter is currently being investigated, and as soon as the courts, because now it's a matter that is in court, as soon as the courts have ruled on the matter, we'll be able to speak on it. I must also indicate, however, that we are conducting our own investigation within the department, and as soon as we are able to speak to the matter, we will do so. Thank you.
Thank you. There's a request for also a Zulu translation. I think most of the questions were linked to Mr. Makaya, the editor of the Mercury. It was around to the PPE, which I think the MEC has answered, and also the issue of infection levels of healthcare workers has also been answered. We request the Premier to respond to the areas, and then also address the Zulu.
No, thanks. Masiphinde sibonge ukuthola ithuba lokwazi ukunikezela i-information ne-update nga le challenge esibhekene nayo yesifo se-coronavirus. Siyafisa ukuchaza nokubonga kuqala kwabaningi abantu bakithi okuthe izolo bajoyina uhulumeni izinhlangano zonke ezikhona banikezela usizo ebantwini njengengxenye yokugubha nokuhlonipha usuku lukababa uformer president uMandela. iNelson Mandela International Day usuku lokukhombisa ubuntu nokuqinisekisa ukuthi sinikezela usizo kulabo abangenalutho ukuzenzela. Sidlulisa futhi umyalezo wokuzwelana nomndeni wakaMadiba ngokudlula emhlabeni kukadadewethu uZinzi Mandela. Ngokwe update yanamuhla siyafisa nje uqale sibonge kuhulumeni ukuthi isinqumo sokuthi kuvalwe ukuthengiswa kophuzo nokuthi kuphuzwe public silekelela kakhulu ngoba sesiyabona already imbhede ebihlale ioccupyeka isikhathi ngesikhathi manje iya ngokuvuleleka for abantu bakithi ukuthi kukwazi ukuthi balashwe ngoba isikhathi esiningi uphuzo luholela engozini futhi luholele odlameni okuye ku result ukuthi abantu balimale bayithole sebedinga usizo ezibhedlela. Siyafisa ukugcizelela ukuthi siyahambisana nalesi sinqumo sikahulumeni futhi sikholwa ukuthi sizolekelela ukuthi sikwazi ukwehlisa irisk esinayo njengamanje. Siyafuna ukubonga inhlangano zabasebenzi esilokho esibambisene nayo ekulwisaneni nalolu bhubhane. Inhlangano zabasebenzi zingxenye ebaluleke kakhulu eqinisekiseni ukuthi imigomo neinhlelo ikahulumeni ziyenzeka. Uma singena kweinamba ngqo singasho ukuthi izinga le-infection liyangokuya likhula ngendlela ekhathazayo. Nje inamba zayizolo zisho ukuthi ama cases wonke asebekhona KwaZulu-Natal angu 40,045. Lokhu okuyisibalo esikhombisa ukunyuka kakhulu. Kanti kwabashonile sithola ukuthi abashonile kuleli sonto nje babe ngu 136. Now lokhu uma uqhathanisa izibalo zangesonto edlule nezibalo esinazo kuleli sonto kukhombisa ukuthi igciwane liya ngokukhula kakhulu ngoba kuvela ukuthi izinga elibhebhetheka ngalo lingena kubantu abaningi ngesikhathi esincane ngoba esikhathini esingekho ngaphezulu kwesonto sibe nama cases angaphezulu kuka 2757 as well as 208 deaths. So lokhu kusinikeza ukuthi umsebenzi yebo wenzile kodwa indlela abantu abaminglisha ngayo isaba inkinga. Ngaphekwa lokho iprovince njengamanje is contributing 21% of new cases. Ama-district alidayo uMgungundlovu neTheku. And siyafisa ukugcizelela ngoba kulezi indawo la othola ama-cases enyuka kakhulu. Kodwa asigcizelele ukuthi ayikho i-district engenayo i-case enayo, ayikho futhi i-district la kungekho umuntu oseke wadlula emhlabeni because of i-Covid19. Lokhu ke kusho ukuthi lesifo sesispreade kuyo yonke indawo. And siyacela ukuthi abantu bakithi balandele imigomo njengoba ibekiwe. Ngaphekwa lokho uma kubhekwa ama cases akhona ezinye zezinto ezibalulekayo ukuthi izifo ezibonakala ziba ingxenye yalokhu ukuthi abantu bagcine beshonile esikubiza phecelezi underlying or comorbidities, izifo ezihambisana nalokhu okuthiwa i-high blood pressure ngokunjalo nesifo sikashukela. So siyacela futhi siyakhuthaza ukuthi abantu bakithi bazame ukuzibhekelela, bazame ukwenza izinto ezokwehlisa izinga lokunyuka kwalezi zifo. Ngokwe-availability ne-admission singasho ukuthi abantu aba-admithiwe kumanje abaseyibhedlela ngenxa yalesifo bangu-1612 kanti labo abakuyibhedlela ikahulumeni bangu-1220 kanti abaseyibhedlela ezizimele bangu-1220 kanti abaseyibhedlela zikahulumeni bangu-392. Itotal yabo bonke abantu abalashwayo kumanje ibhedlela u-1612. And siyafisa ke ukugcizelela ngoba uma abantu baqala baba seyibhedlela it shows ukuthi labo bantu izinga lokuthi abantu bagule kakhulu liyanyuka uma bengenakho ukuzinakekela. Siyafuna ukuthi sigcine ngokuthi kubasebenzi bezempilo abantu uma ubala isibalo sonke sabantu abathelelekile abangu 40,045 cases uyabona ukuthi ama cases athinta abantu abasebenzi eminyangweni kwezempilo angu 1557, lokhu okungu 4% wawo wonke ama cases. Iningi lalabantu onesi kodwa khona nabanye abasebenzi othola ukuthi abasebenzi abangodokotela abanye abasebenzi abakwezinye izingxenye ezihlukene. Siyagcizelela namanje ukuthi isolution okwamanje iwukuthi sonke silandele imigomo ebekiwe, siwashe izandla ngamanzi nensipho for at least 20 seconds, siphinde futhi siqinisekise ukuthi uma singakwazi ukuwasha izandla sisebenzisa ama sanitizer, sithi uma sikhwehlelele ndolwaneni, uma futhi seyindaweni enabantu abaningi sigcine i-social distance okungenani ka 1.5 meters. Siyabonga.
Honorable Premier, Honorable MEC. Liz, I think the question also was answered. Liz from the Mercury, it was answered. It's Nkosazana to MC. It seems a lot of interest from Nkosazana to police, we are adjourning for this week, and that also invite you tomorrow. The Premier will have another media briefing to communicate reports and outcomes of investigation. The briefing will take place here at the Disaster Center at 2:30 tomorrow afternoon. Thank you very much. But we'll issue an advisory to that effect. Thank you.